have two bones in the forearm, ulna and the radius, and finally a group of bones in the hand. We call them carpals, metacarpals, and phalanges. So let's start talking about each one of them. First, we have the clavicle. So this is the clavicle. It is an S-shaped bone. Why it is S-shaped? Because as you can see, there is a curvature here. It is located horizontally in the body, and this bone, it is the only bone that connects the bones of the upper limb with the trunk. Okay? This bone, it is palpable, so it means that you can feel it on the patient, and it is a long bone. What does it mean it is a long bone? It means that it has two ends and a shaft in between. Okay? So, what are the characteristics of this bone? We call this bone the bone of tools because it has two ends, it has two surfaces, and it has two borders. Let's start with the ends. According to the ends, either we call it according to its attachment, or according to its location, or according to its shape. So, here, this is the medial side. So I can call this end the medial end. When you go to the lab, you realize that the medial end, it is a triangular end. So the shape, it is triangular in shape. It is located medially, and since it is attached to the sternum, I call it the sternal end. Okay? So this end, either I call it sternal end according to its attachment, or triangular end because of its shape, or the medial end according to its anatomical position. Okay? So, to which part of the sternum this part it is attached? It is mainly attached to the manubrium, which is the upper part of the sternum, and the first costal cartilage. Next, we have the lateral end here. So this is the lateral end because it is located laterally. It is a flat end. So when you go to the lab, you compare both ends with each other. You see that this is triangular in shape, while the lateral end, it is flat end. And I call it acromial end because it is attached to the acromion of this scapula. Okay? Is that we call it acromial end, and this is sternal end according to the attachment. This is the lateral end, this is medial end according to the anatomical position, or flat end and the triangular end according to the shape. Okay? So this is regarding the ends of the clavicle. Next, let's talk about the surfaces. I have two surfaces here. Either I have the superior surface and I have the inferior surface. What are the characteristics of each surface? The superior surface, it is smooth surface, while the inferior surface, it is a rough surface. Why do you think the inferior surface, it is rough? Yes, it is site of attachment of different structures, okay? When different structures attach to the bone, this area becomes rough, okay? So this is regarding the surfaces. I have superior smooth surface, inferior rough surface. Then we have the borders. I have here anterior border, and this is the posterior border. When we look to the anterior border, the medial 2/3, it is convex, while the lateral 1/3, it is concave, okay? So according to this transition here, this bone, it is S-shaped bone. Why? Because its border anteriorly, the medial 2/3 here, it is convex, while the lateral 1/3, it is concave. Okay? Why it is important to know all of these characteristics? Because when you go to the lab, you should know, is this clavicle, it is the left clavicle or the right clavicle? How would I know? I look to the characteristics, okay, and put it in the anatomical position. So back to the inferior surface, we said it is a rough surface because it is site of attachment of different structures. What are these structures? Starting from the lateral side, so this is the acromial end. As you can see, it is a flat end. So this is lateral side. This triangular end, it is the sternal end. So this is medial side. I will start from the lateral side here. First, I can see a small tubercle here. We call it the conoid tubercle. Why it is conoid tubercle? Because I have a structure called conoid ligament. So, conoid ligament attached to this conoid tubercle. Okay? This conoid ligament, it is a part of a large ligament. We call it coracoclavicular ligament. So why it is called coracoclavicular? According to its attachment. So it is attached to the coracoid process and the clavicle. So I call it coracoclavicular ligament. It has two parts. The first part, I call it conoid ligament, which is attached to the conoid tubercle. What about the second part of this ligament? It is the trapezoid ligament. This trapezoid ligament attaches here to what we call trapezoid line. Also, I find it on the lateral end of the clavicle. Okay? So, I have a large ligament. We call it coracoclavicular ligament. It attaches between the coracoid process and the clavicle. It has two parts. First one, I call it conoid ligament, which is attached to the conoid tubercle. Then I have the trapezoid ligament, which is attached to the trapezoid line. Okay? Both of them are located on the lateral end of the clavicle. Then almost in the middle, I find a groove. We call it subclavian groove. Why? Because I have a small muscle, we call it subclavius muscle. It is attached to this groove. Okay? Finally, at the medial side here, I have impression for a costoclavicular ligament, which is another ligament. Okay, is that here, costoclavicular ligament. Here I have a large ligament, we call it coracoclavicular ligament with its two parts. And in the middle, it is site for muscle attachment. We call it the subclavius muscle. Okay? So this is why the inferior surface, it is rough. Very important here, I have a clinical application for the clavicle. Since we said that the clavicle, it is S-shaped bone, because as we said here, we have a curvature. We said that medially, it is convex anteriorly, and the lateral 1/3, it is concave. So I have a transitional area here between the convexity and the concavity. And this transitional area, it is the weakest area in this bone. Okay? وبالتالي, if any fracture happened to this bone, it will happen where? At the transitional point between the convexity and the concavity of the bone. So what will happen when this bone gets fractured? What do you think the patient will suffer?
ما رح يقدر يرفع ايده.
Yes, exactly. So we said this is the only bone that carries the whole upper limb to the trunk. So when a fracture happens here, the patient come to the clinic holding his upper limb, because all the force here is not transmitted back to it. So it will hold like this, the upper limb, so you can directly know that there is a fracture where in the clavicule. Okay? Any questions so far? The second bone from the bones of the upper limb, we call it the scapula. What type of bone is the scapula? It is a flat bone, okay? It is a flat bone and it is triangular in shape. Since it is a triangle, so it has the characteristics of a triangle. It has 3 angles, it has 3 borders, and it has 2 surfaces, okay? So it is a triangular flat bone with 3 angles, 3 borders, and 2 surfaces. What do we call the angles here? First, I have the superior angle, which is located on the medial side. Then we have the lateral angle, or we also call it the glenoid cavity, which articulates with the head of the humerus at the shoulder joint. And finally, we have here the inferior angle, okay? Where do we find the scapula in the anatomical position? It is located between the 2nd and the 7th ribs, okay? So this inferior angle will be at the level of the 7th rib, and this angle, it is palpable also. So I can feel it on the patient. When I feel this area, I know I am at the level of the 7th rib, okay? So the second bone here, we have the scapula. We said it is triangular bone. It is a flat bone, and it is located from the 2nd up to 7th ribs. We said it has 3 angles, superior angle, which is located medially. I have the lateral angle, or we call it also the glenoid cavity. And finally, the inferior angle, which is palpable and located at the level of the 7th. What about the borders here? I have first the superior border, which is between the superior angle and the lateral angle. I have the medial border between the superior angle and the inferior angle. And finally, I have here the lateral border located between the lateral angle and the inferior angle. Okay? What about the surfaces here? I have anterior surface, or we can call it the costal surface, okay? And finally, I have the posterior surface, okay? What are the characteristics of the anterior surface? I find only a large fossa here anteriorly. We call it the subscapular fossa. Why? Because I will find a muscle here that takes origin from this fossa. We call it subscapularis muscle. Posteriorly here on the posterior surface, I find a process dividing the posterior surface into 2 fossae. This process, we call it the spinous process, okay? So how can I know this is the anterior and this is the posterior surface? From the spinous process. So we said this process will divide the area into 2. Above this process, we call this fossa supraspinous fossa because it gives origin to a muscle. We call it supraspinatus muscle. Below this spine, we call this area infraspinous fossa because we have another muscle attached to this fossa. We call it infraspinatus muscle. Okay? When I move with the spinous process here up to the end, I come to a process, we call it the acromion, okay? So the acromion here, it is located at the lateral end of the spinous process. Anterior here to the acromion, I have another process, we call it the coracoid process. So how many processes do I have? 3. I have the spinous process, which is located on the posterior surface here. Then, at the end of the spinous process here, I have the acromion. Anterior to the acromion, I have another process here, I call it coracoid process, okay? And here, this is the lateral angle, we call it the glenoid cavity. So this is the glenoid cavity. This is where it articulates with the head of the humerus to form the shoulder joint, okay? On the top of this cavity, I have what is called supraglenoid tubercle. It also gives attachment here, by Allah, for the long head of biceps brachii muscle. And inferior to this cavity, I have infraglenoid tubercle. It is a site of attachment of a different muscle. We call it the long head of triceps brachii muscle. Okay? Here, this is, we said, this is the superior border. When you move on the superior border, you realize that there is a notch. Okay? That is a حفرة here. This we call it the suprascapular notch. On the top of this notch comes a ligament. تخيلوا here we have a ligament, so I have a notch. If a ligament comes on the top, the notch will become as a foramen. Okay? So it is a site for vessels and nerves to pass at this area. Okay? I think this is all about the scapula. Any questions? Next, we move to the humerus, which is the bone of the arm. So, in the arm area, we have only a single bone. We call it the humerus. So, what type of bone is this? It is a long bone. Why? Because it has 2 ends and a shaft in between. I call this end, this is the proximal end. This end, it is the distal end. And in between, this is the shaft. Okay? This bone, it is the longest and largest bone in the upper limb. Okay? Not the whole body. So this is the longest bone in the upper limb. So it articulates proximally here with the scapula at the shoulder joint. And distally here, it articulates with the 2 bones of the forearm at elbow joint. Let's see the characteristics of each part of this bone. First, at the proximal end, we have here what is called the head of the humerus. This head, it is 1/3 of a sphere, okay? We said earlier, it articulates with the glenoid cavity at the scapula to form the shoulder joint. Then, this line, if you see this line, this is the anatomical neck of the humerus. And also, I have another neck here. We call it the surgical neck, okay? So, I have the head. Below the head directly, I have the anatomical neck, and the most constricted area proximally, this part I call it surgical neck. Why do you think I call this area surgical neck? Yes, it is site for common site of fracture, okay? Then we have here tubercles. Laterally here, I tubercle, I call it the greater tubercle. Anterior to it, I have a smaller tubercle. We call it the lesser tubercle. Okay? So if I look here, this is lateral tubercle, which is the greater tubercle, and anteriorly here, I have the lesser tubercle. So what should I know here at the proximal end? I should know there is a head, which is 1/3 of a sphere. Below the head directly, I have the anatomical neck. Most constricted part, I have the surgical neck. Why surgical? It's common site of fracture. Then I have two processes here. Laterally, I have the greater tubercle. Anteriorly, I have lesser tubercle. Now, a very important area here between these two tubercles. I have a groove. We call this groove intertubercular groove. It means a groove between two tubercles, okay? Intertubercular groove. Or I can call this groove the bicipital groove. Why it is bicipital groove? Because the tendon of biceps brachii muscle will pass on the top of this groove, okay? When I look at this groove, يعني أخذت مقطع وطلعت على characteristic of this groove, I find it like this, like a box, okay? So it has two walls and a floor. Why should I know this? Because each part of the groove, it gives site of attachment of a different muscle. So I have muscle attached on the floor, I have two muscles attached on the wall, and I have the biceps which passes on the top of this groove. So every time دائما بجيب أسئلة هاي الاريا why؟ لأنها لها علاقة before muscles, okay? We until now we know only اللي هي البايسبس. Later لما نحكي عن muscles نرجع to this area and we talk in details about each one that is attached to different parts of this group, okay? So here, just to realize the difference between the anatomical neck, which is located directly under the head of the humerus, and the surgical neck, which is the constricted part here. And we call it surgical due to the common fractures occur at this area. So here, clinical application, we said earlier that the surgical neck, it is common site of fracture. But why it is important? Because I have important structures that are related to the surgical neck of the humerus, which are the axillary nerve and posterior circumflex humeral artery, okay? So why is it important? If fracture occurred at this area, this structure could be damaged due to the fracture, okay? So this is very important to know the structures related to the surgical neck. So if any fracture happened, I should check what? The axillary nerve, if it's still functioning or not, okay? Next, we move to the shaft of the humerus. What should I know about the shaft? Two things, okay? On the lateral side of the shaft here, I find a roughened area which is V-shaped. We call it the deltoid tuberosity because it is site of attachment of deltoid muscle. And posteriorly here, I have a groove. We call it the spiral groove. And this groove is very important. Why? Because I have important structures pass within this groove. What are they? I have here profunda brachii artery and the radial nerve. Okay? So, axillary nerve, it is related to what? The surgical neck. The radial nerve related to what? To the spiral groove. Where I find the spiral groove? On the posterior aspect of the shaft of the humerus. Okay? Finally, the distal end of the humerus. What do I find? First, at the medial side, we find what is called the trochlea. Trochlea معناها البقرة. So they find this area, it looks like البقرة, so they call it the trochlea. It is located medially. And I have another process here, we call it capitula. شافوها, it looks like a small head, okay, رؤيس, فبسموها capitula. So I have medially the trochlea and laterally I have the capitula. Both attach to the bones of the forearm. So the trochlea attaches to what or articulates with the ulna, while the capitulum articulates with the radius. Okay? Then on the both sides here, on the side of the trochlea, I have the medial epicondyle, and here I have the lateral epicondyle. Okay? Then when I move to the top here from the medial epicondyle, I come to a roughened area, I call it medial supraepicondylar ridge, and here I have the lateral supraepicondylar ridge. All of these are signs of attachment of muscles, okay? We will talk about them later. So I have medial supraepicondylar ridge, I have lateral supraepicondylar ridge, I have the medial epicondyle, I have lateral epicondyle, here I have trochlea and the capitula. This is the anterior view. So anteriorly here, on the top of the trochlea, I have a fossa. This fossa, we call it the coronoid fossa. Why it is called coronoid fossa? Because at the ulna, I have a process, it is called coronoid process. When I do flexion here at the elbow joint, the process will come inside to this fossa, so we call this fossa coronoid fossa. On the top of capitulum here, I have another fossa, I call it radial fossa, because the head of radius here, when I do flexion at the elbow joint, it will come to the radial fossa. So what about posteriorly? When I do extension like this, I have a process, it is called olecranon process of the ulna. It will come inside these fossa, so I call it olecranon fossa. So posteriorly, I have only one large fossa for the olecranon process. Okay? So, what should I know at the distal end? I should know the trochlea medially, capitula laterally. Here on top I have coronoid fossa, while laterally I have the radial fossa. Here I have medial and lateral epicondyles, and here I have medial and lateral supraepicondylar ridges. And posteriorly I have one large fossa, I call it olecranon fossa. Very important structure passes posterior medial epicondyle, which is what? The ulnar nerve. Okay? That's why لما تخبطوا ايدكم like this posteriorly ايش بتحسوا؟ زي كهرباء توصل لوين؟ To the hand. Why? Because you hit what? The ulnar nerve, which passes here behind the medial epicondyle, which becomes superficial at this area. So when you hit this area, you can hit the ulnar nerve. Okay? So what are the nerves related to the humerus? First we said at the surgical neck, what do we have? Axillary nerve. In the spiral groove, radial nerve. Behind the medial epicondyle, ulnar nerve. So these structures are very important to know. Okay? Okay, this is an X-ray. Let's see what we can identify here. What do you think this is? Clavicle. What is this end? acromial end, which is articulate with what? So this is the acromion of the scapula. When I move like this, what is this? Spine of the scapula. What do you think is this? Coracoid process, which is anterior to the acromion. Here, what do I have? This cavity, glenoid cavity, articulates with the head of the humerus. So what is this? Related to what? Axillary nerve. Okay? Any questions? So let's move to the bones of the forearm. We said we have two bones in this region. We call them radius and the ulna. Radius, which is the lateral bone, while the ulna, it is the medial bone. Which one is longer than the other? الألنا it is longer. يعني الراديوس بلاقيها shorter. Okay? And it is the lateral bone. إذن the head of radius located at the proximal end. لما أنزل like this to the distal area, I find إنه الwidth it will become wider. Okay? يعني تكون narrow at the top and distally it gets wider. Okay? How is its articulations? We said the head will articulate with the capitula of the distal end of the humerus at the elbow joint. Here, the distal end, it will articulate with two carpal bones. I call them the scaphoid and lunate at the wrist joint. And also there's articulation between the ulna and radius themselves. So these two bones, they also articulate with each other at two joints. We call them proximal and distal radio-ulnar joints. Okay? What do you think is the movement of these joints, the proximal and distal radio-ulnar joint?
rotation.
Rotation, نسميها supination and pronation. Okay? Here at elbow, I have flexion, extension. على wrist, I have different movement. بس هاي الموفمنت اللي بعملها, it is at proximal and distal radio-ulnar joints. Okay? Let's have a look at the proximal end of the radius. So here I have the head of the radius. On the top, I find a concavity. Why there is a concavity? To articulate with what? With the capitulum اللي كانت like a ball. So it will come inside here, the table like this. We said when we have a head, there should be a constricted area. We call it the neck. So this is the neck of the radius. And here I find a tuberosity. We call it radial tuberosity. Okay? So at the proximal end, I should know about the head, the neck, and the radial tuberosity. Let's have a look at the shaft of the radius here. The medial border here of the shaft of the radius, I find it very sharp border. It's a high border here at the medial side of the shaft of the radius. It is very sharp. Why? Because I have a membrane, as you can see here. It articulates the radius with the ulna together. We call this membrane interosseous membrane. So it is membrane between two bones, so I call it interosseous membrane. So this membrane attaches to this sharp border, which is located at the medial side to the shaft of radius, and I call it interosseous border. Okay? So I have medially interosseous border, which is a very sharp border for the attachment of interosseous membrane. What about the distal end here? The distal end, when I look down like this, بطلع من الأسفل, I find two fossae here for the articulation with carpal bones. At the lateral end here, laterally, I have fossa fourth styloid bone medially for the lunate bone. Then I have here the styloid process, and I have a notch here at the medial side. I call it ulnar notch. Why it is called ulnar notch? Because the head of the ulna, it is located distally and it articulates with the radius at this notch, okay? So when we go back like this, so this is the head of radius, while this is the head of the ulna. The articulation between the ulna and radius distally occurs between the head of ulna with the ulnar notch on the radius, okay? So the head will come at this notch, which is the ulnar notch of radius, okay? So very simple about the radius. Here, the distal end posteriorly, I have a tubercle here, we call it dorsal tubercle. On both sides, I have different grooves due to the tendons of different muscles. We will talk about them later, so don't worry about the rings now, okay? بعدين كلها رح تعرفوها بمحاضرة العضلات. Any questions لهلا؟ Okay. Now the second bone in the forearm, we have the ulna. We said the ulna, it is longer and it is located medially. So it is the medial bone of the forearm. Is it a long bone? Yes, because it has two ends and a shaft. Also, I call this end proximal end. This is the distal end and this is the shaft, okay? What about the articulation? This bone articulates here with the trochlea of the humerus at the elbow joint. What about the wrist? Very important to know that there is no articulation between the ulna and the carpal bones. So in ulna, it is excluded from the wrist joint. What about this space here? On this space, I have what? I have a disc here. It comes and it separates the ulna from the carpal bones and it's excluded from the wrist joint, okay? And finally, it articulates with the radius at proximal and distal radioulnar joints, okay? Here, this bone, it is opposite to the radius, so it is wider above. كل ما أنزل لتحت, it becomes narrower, okay? What about the proximal end? بيشبهوا البروximal end زي المفتاح الإنجليزي like this. So it has in the middle a notch. It has two processes. Posteriorly here, this is the posterior of the ulna. I have a large process, we call it olecranon process, which comes inside what? Olecranon fossa, located in the posterior aspect, the distal end of the humerus. Anteriorly, we said برضو we have the coronoid process, which comes inside the coronoid fossa when we do flexion at the elbow joint. And in between here, I have trochlear notch to articulate with the trochlea of the humerus, okay? So I have here trochlear notch. Here posteriorly, I have the olecranon process, and anteriorly here, I have the coronoid process. Here, when you look at the lateral side, you find the radial notch. إيش هاي الراديال notch؟ لا. إيش راح يجي هون؟
الهيد.
الهيد of radius، صح؟ At the proximal radioulnar joint. هاي بتقابل مين؟ ulnar notch اللي كانت وين؟ على الراديوس ولكن في الديستال end. Okay? Then we have here tuberosity of ulna, and finally I can find the okay, supinator crest for the attachment of supinator muscle. Let's have a look at the shaft. إيش الوحيد اللي نعرفه عن الشافت? The same board border شفناها على الراديوس. We call it the interosseous border for the attachment of interosseous membrane. Here for this bone, I will find it at the lateral side of the shaft of the ulna. What about the distal end? We said the distal end, it is narrower compared to the proximal end. It has a head. This head, we said it articulates with the radius at the ulnar notch. Then we have here the styloid process of the ulna. Here, inferiorly, when I look at this area, there is articulation with the disc. We call it the articular disc, which separates the ulna from the carpal bones and excluded from the wrist joint. Okay? I just read only about the interosseous membrane, how it transfers the forces according to the direction of the membrane. فقط read only for your own knowledge. Let's have a look at these X-rays. نطلع ايش ممكن نلاحظ في هالاريا. What is this part? Humerus, which part? Distal end, صح? So this is the distal end. What about this fossa here?
كونويد.
Hi, coronoid. Olecranon. Isn't this is posterior? So what is this process? Yes, this is the olecranon process of the ulna. So this side, it is what? Which side? Is it medial or lateral? Lateral. كيف عرفت it's lateral? من الراديوس. الراديوس we said it is the lateral bone. فإذا قلت لكم هاي الاريا, what is this? Lateral epicondyle. إذا قلت لكم important structure at this part, what is it? Ulnar nerve. And related to what? The medial epicondyle posteriorly. So what is this process anteriorly? Yes, coronoid process. What is this part? Head of radius. Here? Neck of radius. Okay, Niji here. What is this? Hi. Trochlear notch. Hi. Coronoid. Hi. Olecranon process. Okay, any questions لهلا? Let's move to the hand. I have group of bones forming the hand. We call them carpal bones, metacarpal bones, and the phalanges. Okay? نبدأ بالcarpal bones. What type of bones they are?
irregular.
Short bones. Okay, so they are short bones. They are 8 in number. They are located like in 2 rows. Each 4 bone in 1 row. Okay, so we have 2 rows. In each row I find 4 carpal bones. We call them the proximal row and the distal row. مهم جدا أعرف اللي هو أسماء هذول البونز. هلا رح نحكي عنهم. Then we have here the metacarpal bones. إيش يعني ميتا؟ ما بعد الكاربال. Where do I find these bones في الهاند؟ مين يحكي لي؟ Here. Okay. إذن this part I have the metacarpal bones and the bones forming the fingers or the digits. بنسميهم what? الphalanges. Okay. These phalanges في الميديال 4 digits هدول I have 3. اللي هي proximal, middle and distal phalanx, except for the thumb. Here I have only 2 اللي هي proximal and distal. Okay. Now let's talk about the carpal bones. اتفقنا they are 8 bones, each 4 of them located at 1 row. So I have 2 rows, the proximal row and the distal row. I call them usually from lateral to medial. How do I realize this is lateral? Is thumb diamond located lateral في anatomical position. So this is the proximal bone. We said we have 4 bones. Let's have a look at them. First, this one, I call it the scaphoid, okay? This scaphoid, shafura, it looks like a boat. It is boat-shaped bone. It has tubercle. I call it tubercle of scaphoid. Next, I have the lunate because it's crescent in shape. And then I have triquetrum. On top of triquetrum, I find the 4th bone, which is the pisiform. So I have 4 carpal bones at the proximal row. They are starting from lateral to medial. I have scaphoid, lunate, triquetrum. On top of it, I have the pisiform. Okay? What about the distal row? Okay? Again, I start counting from lateral to medial. Okay? I have first one, trapezoid. Bardo, it has tubercle. I call it tubercle of trapezoid. Then I have trapezium. Then I have trapezoid. Under the middle finger, I have the capitate. And finally, I have the hamate, which has a hook. We call it hook of hamate. Okay? So I call them from lateral to medial. First row, scaphoid, lunate, triquetrum, pisiform. Then I have trapezium, trapezoid, capitate, and hamate. So how can I memorize this? Usually we put two sentence. First letter of this sentence بتمثل عندي one of the carpal bones. So for example, this sentence, stop letting those people touch the cadaver's hand. S, it's for scaphoid. L for lunate. T, triquetrum, etc. Okay? Okay, now we have important area, we call it the carpal arch. كيف شكلت هاي الcarpal arch؟ إذا طلعت أنا على structure of the carpal bones بلاقي في عندي curvature like this. Last we said here that the scaphoid, it has a tubercle, and we said the trapezium, it has a tubercle. These 2 tubercles بشكلوا عندي a wall like this at the lateral side. Then medially we said the pisiform located on the top, and we said that the hamate, it has a hook. And both these structures form another wall at the medial side. Okay? إذا في عندي الفلور شكلت من الcarpal bones. Then I have 2 walls. كيف شكلوا هاي الوولز؟ على lateral side from both tubercles here, على medial side from pisiform and the hook of hamate. فشكلت عندي this area which we call it carpal arch. Okay? إذا what is carpal arch؟ الفلور عبارة عن carpal bones، lateral walls عبارة عن tubercles، والmedial wall عبارة عن pisiform and hook of hamate. ايش أهمية الارش هاي؟ This arch ما بتكون like this, just an arch. I have a deep fascia. It comes on top of this, okay? And بتسكرها like this وبتشكل عندي tunnel. We call it carpal tunnel. إذا كيف شكلت الcarpal tunnel؟ من الcarpal arch. On top of it, I have اللي هي fascia, we call it اللي هي flexor retinaculum. إيش أهمية الtunnel هاي؟ بمر من تحتها very important structure, muscle, nerve, etc. We'll talk about them later في محاضرتنا. Okay? بس مبدئيا لازم نعرف we have carpal arch. هاي الarch تتحول ل carpal tunnel when it is closed by the flexor retinaculum. Okay? Next we have الميتاكاربلز. ميتا معناها ما بعد الكاربلز. هدول they are 5 in number. I count them برضه from lateral to medial. إذا number 1 هي اللي هي أسفل الثumb. Then 2, 3, 4, 5, etc. We said we find them here. في راحة اليد. What type of bone is this?
long.
Long bone. Why it is long bone? Because it
Two
has
ends and
two
shaft.
ends and a shaft in between. قلنا they are 5 in numbers. Finally, the phalanges here. We said للميديال 4 digit. I have 3 phalanges في كل digit. Except for the thumb, I have only 2. Okay? We call this proximal middle distal, proximal middle distal. هاي بسميها proximal and distal. Each one of them it has a head, it has a base and a shaft. وبالتالي what type of bone is each one of these?
long.
It is a long bone regardless of its length because it has 2 ends and a shaft in between. So how many phalanges do I have?
14.
14. So هدول 3 ضرب 4 12. هدول 2 so I have 14 phalanges like this. Here X-ray بس نشوف هدول الكاربل بونز. Here هاي المنطقة السوداء for what?
the desk.
Yes اللي هي عملت عندي exclusion للألنا out of the wrist joint. Here بلاقي مين الميتاكاربلز في هاي الاريا and finally here الphalanges. This is the radius اللي قلنا بتكون distally wider compared to the ulna اللي بتكون narrow distal. Okay? Any questions? هاي read only نقراوها about fracture of scaphoid. كيف ما عندنا nourishment في هاي الاريا فممكن يصير عندنا problems. هاي المنطقة اللي هي بالأخضر بتمثل عندنا palpable part اللي هي of the bones. Which bones are palpable? And that's all. Thank you.
دكتورة بس عادي أسألك هون. هون أنتي قلتي أنا ما فهمت يعني إحنا في عنا وحدة هيك زي تنتين هون وتنتين هون.
أيوة.
طب هون فراغ وين صار؟
هذا الفراغ بالنص، ما هون رح يمر structures in between.
يعني أنا حاسة إنه حيكون زي هيك زي
آه.
فاس. طب هون فاضي؟ هو طالع هيك بوكس.
هو هاي الاناتوميكال بوزيشن. هون فلور
أوكي.
يعني أرضية. هون في عندك ارتفاعات. كيف صايرين الارتفاعات؟ من tubercles هير جايين
فوق
هون.
زي قوس يعني.
فصار قوس هيك، وفوق رح يجي اللي هو الريتيناكلم، فرح يصير عندي قناة فيها المنطقة بمر فيها structure.
شكرا.
أهلا.